So in the studio, I do believe it is Terry Wages and also Clyde Deschamp. Morning, guys. How are you?
Good morning, sir. Doing great. How about yourself?
It's good to have you. I think that microphone over there might need to be pulled a little bit closer to you. We will see where we go with this one. I was amazed when I found this out. It's just, it baffles me. And I guess we are one of the only states, or the only state, that does not do this, or does not that prohibits an EMT or paramedic from practicing outside. Are we the only state, or are we one of the only states? You guys know?
Well, we are one of very few, I'll tell you that much.
Yeah.
Mississippi, as far as emergency medical services go, we generally play a lead role in that. We have people coming from all over the country to see what we offer here. We have, 3 systems of care here, as you know. The only state in the country that offers those 3 systems of care: stroke, trauma, and one for serious heart attacks.
Yeah.
And our paramedics play a key role in that. And I think we do have that one glaring weakness, though, and that is that we've got a whole bunch of firefighter folks out there that just don't have the ability to function and help us out right now.
Why, explain that. Why is that?
Well, what happened about 2 years ago, we started to identify some areas in the state that did not have access to medical control, which gives the authority for a paramedic or EMT to operate within their jurisdiction. So as that unfolded over the last 2 years, we started to recognize that we needed to address that. Well, we identified approximately, so far, and it's just an estimate, about 1,800 EMS providers in the state that are not practicing at the level they train. So we've been working on this quite a while. As a matter of fact, it was looked at a couple of decades ago, but the problem is the current statute doesn't allow for the Department of Health to, or give them authority to regulate and govern non-transport EMS. So we got to the point where we knew we had to introduce some legislation to change that statute and add to it so they could recognize that, and by virtue of that, provide that medical control which will allow them to operate at the level they're trained.
I don't want people to get phased out on this one, because it really does matter. I will say this, that just forever in the state of Mississippi, we look at the shortages of nurses, and we're concerned about doctors, but there is a shortage, and it's growing into crisis level as far as EMT and paramedics. Am I right about that across the state? You
are absolutely correct. We have ambulance services right now that just can't find paramedics to staff with. We have some counties in the state that only have one ambulance service. And when you lose a paramedic in one of those counties, you're leaving people essentially without 911 capability. That's it. And what people need to know, and forget about the minutia here of the technicality of the bill and all of that. The paramedics and EMTs have been kind of like that forgotten group out there, but they're not on. They're not forgotten on the streets and in the ambulances. And when there is trauma and when something happens there, I remember reading a story many years ago. Is that a doctor who happened to be kind of a liberal doctor said there are so many people who are going to the hospital and they're living and they live maybe shouldn't have been saved because paramedics are doing such a great job of saving people who would have otherwise died. And his point was it's costing the hospitals a lot, and that was a liberal many years ago. But I think what it says is that paramedics, there are a lot of people who wouldn't be alive if it were not for their expertise. So well, Paul,
you can speak to that.
Years ago, it was a funeral home model where the didn't have paramedics. We had attendants, went out, picked people up, put them in the back of a hearse, and just, carried them to the hospital.
That's right.
Today's EMS system is very different. We have very highly trained people who essentially take the emergency department out to the patient, and they provide this valuable stabilization, as you mentioned, at the house, on the side of the road, wherever they happen to be. And a lot of times those conditions can't wait 20 or 30 minutes until they get to a hospital. So it makes a huge difference in outcomes.
For people who don't know this, I don't think a lot of folks understand this. There are so many different levels there. There's the emergency medical responder. That's an EMR, which is a low-level minimal training. Then there's the EMT, which is a semester of training, provides basic life support. Then you can advance to the advanced medical advanced emergency medical technician, who is the AEMT, with more training and provides some minimal advanced life support intervention. Then there's the paramedic with their training, many complete with degrees, high level of care in Mississippi. Skills include intubating, giving advanced medicines, vascular access, 12-lead EKG interpretations, etc. And then you also have the critical care paramedics, which is a unique licensure for Mississippi. Requires an additional 2 semesters of training beyond paramedic and degree to be licensed by the state. Sounds like we're kind of blending this in with nurse physicians or registered nurses. How do you separate those two things?
Well, we've done a great job in education. We have all these various levels that if we were fully staffed, it would be great. Unfortunately, right now, with our lack of paramedics, we're having to staff ambulances with EMTs, advanced EMTs, pretty much anybody we can get. We're staffing them on the ambulance, not always in the ideal configuration. We're basically down to the point of where we're looking for warm bodies right now.
Yeah. So one of the reasons for that, guys, that if they wanted to take their training somewhere else after that, they are prohibited from doing so. And I mentioned some possible scenarios if they wanted to go to a large factory or whatever it happens to be that wants to hire some healthcare people, they could not do that.
Well, currently under the system we have, they can go to work outside the transport industry. They just can't call themselves paramedics or BMTs or call themselves EMTs. As long as they function under a medical control physician, they can go outside that. The best thing about this bill and this legislation is coming forward with all this thought is over the last 3 months something has evolved that we've needed for a long time, and all the EMS leadership in the state, along with fire, law enforcement, have come together and started communicating. What this is going to do is going to create continuity across the board for all our EMS providers as a whole. It's something we've not had in the past. And now that we're all looking in one direction and all communicating, we can start to address these problems.
Yeah. Is the reason you're wandering around like that as far as the entire industry of the EMTs and paramedics because you're not under any particular board, or what's the structure, and what has the structure been?
Well, what happened is in the fire service, for example, this has evolved over the last 3 decades in the state. So back in the 70s, the fire departments didn't run EMS. So as they started to increase their EMS capabilities and get involved in EMS across the state, it started to evolve. Well, we reached a point now, just to give you a few statistics, is we have about 750 fire departments in the state. So as of now, we're seeing about 500, just over 500 of those that are running EMS now. So about 80%, between 70-80% of the calls fire departments run now are EMS related. So as a result, we see the need to start communicating to create that continuity between the transport agencies and the non-transport.
Let's get into the legislative and what you need when we come back in just a moment or two. We're back live on a Wednesday with Terry Wages, Director of Mississippi Firefighters Academy, and also Clyde Deschamp, who's the Director of Mississippi Healthcare Alliance and Central Mississippi EMS District. A couple of things, Terry and Clyde, you guys have said, just to go over here. A large sector of the EMS workforce is employed by fire departments, and they respond and provide initial care at the scene. And since they're not part of the ambulance service, they can't be licensed by the Department of Health, and that causes them to lack the ability to obtain organized medical direction, and also that the Department of Health's inability to license EMA providers that don't work in an ambulance service limits the career path and forces a lot of them to leave. But there are inherent things about EMT and paramedics. It's low pay. I can't think of another occupation that is needed as much, and what they do is saving lives, that is paid like that. One of the C-Spire text lines says, problem is simple. Pay for medics is low, reimbursement for services are low, and companies can't pay the paramedics to compete with the hospitals. And right now, hospitals are paying premiums to get paramedics to work in the hospital. So that's taking away from the ambulances. Can somebody respond to that?
Well, Paul, one of the things we're seeing is, as you mentioned, there's a problem with reimbursement compared to other segments of the healthcare market. Let me give you a good example, though. Something called treat and release is not paid for. Just about every single day, every ambulance service will respond to an unconscious diabetic at home. Maybe he takes a little too much insulin, maybe forgets to eat, but the family member comes home, finds him unconscious on the floor. They call the paramedics. They come there. They check the glucose. They start an IV. They give them something called 50% dextrose, which essentially turns to sugar once it's administered. A few minutes later, the patient's awake, alert, oriented, completely stable. Well, they pack up their stuff. They counsel the patient about how to make sure that doesn't happen again, and they leave. They don't get paid a penny for that. The way the law is written right now, there is no payment for treat and release. So the alternative to that is to transport each one of these patients to a hospital, where they then incur a $1,500 or $2,000 bill, which is absolutely unnecessary. So one of the things we need to try to work on is to get some reimbursement for that a treat and release type thing. And hopefully, this House bill, this 821 that we're working on, will kind of give us a foot in the door to start talking about some of those things as well.
HB 821 is the number of the bill. Who's handling that in the House?
Well, it was put over through Commissioner Cheney's office in his legislative packet, and Representative Hank Zoomer and Representative Jill Ford have been handling the bill. It's already processed through the House Insurance Committee. We're hoping it's going to come to the floor for a vote today. Commissioner Cheney, as you know him very well, he has been in front of this for about 2 years now, working on trying to figure out a system. Being state fire marshal as well as insurance commissioner, he's worked with the legislators very well. We do have a lot of legislators at the Capitol that understand the intricate details of this EMS problem. Many of them do. Many of them are working vigilantly to try to fix this and help us get more paramedics out on the street, more people that can practice. But we still have a long ways to go. This House Bill 821 is really just the start of something we need to be planning for over the next 2 to 5 years to help combat this problem we have in the state.
Terry, I don't know if you guys have checked, but how do we look as far as other states? Are we under the same organizational chart, or how do other states, either one of you, how do other states differ from us?
Well, many states have different agencies. I'm not familiar with all the states, but I know a few have different agencies that are involved in EMS regulations and governing EMS in their states. There's different education and training programs throughout the state on what states do. One good thing about this bill and this problem we've had is we're starting to open our eyes to being able to think outside what we normally do. And we've got all the people at the table, the Mississippi Healthcare Alliance, the Mississippi Insurance Department, Department of Health, the EMS educators, the Mississippi Ambulance Alliance. All these folks are now in a room talking about this problem, trying to come up with ideas to help this issue.
Clyde, I'm just thinking, if you go back, and I do remember those days. I'm old enough to remember the days when I remember a farmer who lived not on the other side of our land, and he died of a heat stroke, had a heat stroke, and it was the ambulance. Now, it wasn't an ambulance back then. It was just a hearse that picks him up and takes him to the nearby doctor. So we are basically going back to that if all you've got is a driver of an ambulance and somebody sitting in the back just keeping them comfortable.
Well, we haven't quite got to that point yet. I mean, we've still got paramedics on most trucks, and we've got EMT advanced on the ones that we don't have paramedics on. So, I mean, people can still have trust in the system. We haven't had a systems failure yet. Some people think we're approaching that. One of the biggest challenges we're facing right now is what everybody's referring to as wall times. And the hospitals have been inundated with COVID patients. The beds are full. So when an ambulance shows up, there's no bed to put a patient in. So they get put on the wall, as it's called, in a hallway someplace, waiting with the patient, sometimes for as much as 6 or 8 hours. That is taking paramedics out of service as well. So we're short-staffed, and now we've got them sitting on the wall for hours and hours at a time, waiting to get a bed in the hospital. That just compounds the problem and makes it tremendously worse.
I don't understand this because the connectivity between someone at the scene of a horrific crash, taking that patient to the emergency room, communicating with the doctor on the life support things that need to be done, and then you get into an emergency room and you have a nurse there that assists the doctor. Those two life-saving responsibilities, jobs, are commensurate in their importance to keep that patient alive. Why the heck is the paramedic in this particular case so beyond that pay scale? I mean, how did we get there?
Well, I think it's just it's supply and demand. It's that to some extent, but it's the fact that something you mentioned earlier, the ambulance services just aren't recognized as being a bona fide component of the healthcare system in a lot of cases, and reimbursement reflects that. So we've got to do something about reimbursement. We've got to do something.
Is that come through the insurance commissioner himself, or the Mississippi Department of Health, or is that legislative?
No, the reimbursements for the ambulance providers goes through the Medicaid, Medicare systems, and also through private insurance companies that they bill. That money that comes back to the ambulances, I mean, from the perceptive point of view or the perception of what it is that an ambulance, just say a lot of people think they get $1,500 to transport a patient. In some cases, it's restricted to just a certain amount under Medicaid, Medicare of what can be paid for that transport, depending on what's done. So we need to look at that reimbursement rate so the ambulance companies then can transfer those funds to help bring up paramedic EMT pay.
Yeah.
And then also, most importantly, is we need to look at the culture of our EMS providers on the ambulances, creating that positive culture that keeps them in the business. We see more and more of the EMS professionals out in the field that are leaving this profession for various reasons, the stress load, the work hours. It's just a lot of things that just drive them to other professions. So we need to look at that as well, because we need to retain these people. It's a long, long time to get one of them trained to that paramedic level. Is
there a number that we're down, Clyde, as far as where we should be, like highway patrolmen and police officers? Is there a number that if you're looking at full staffing, what would you say that number would be?
Well, we're dealing with kind of a hodgepodge of different public, private organizations in the state, and that number is difficult to pin down. I would tell you that we're probably down, I would say, near 40% over what's normal. So we're feeling the pain from this. It's a significant shortage.
Well, if you're down over around 40%, it would be in anything. That's almost half. So that's a little bit scary. Final thoughts from Terry Wages, and Terry is the director of Mississippi Firefighters Academy. Terry, your final thoughts, sir.
Yeah, I think the most important thing we need to focus on is where we go from here. And now that everybody's in the same room, everybody's looking in the same direction and speaking the same talk, and looking at the problem as a whole, as it's addressed from the very first patient contact all the way through the hospital system, then we can start to identify what we need to address. So my final thoughts on this, the most important thing we've accomplished, not only with this bill, is getting everyone on the same page and the continuity of this planning, strategic planning for this as we move forward.
I got it. Only a couple of seconds here, but Clyde, your final thoughts.
Well, I agree with Terry. I think we've got to get the firefighters freed up so they can practice in the state, number one. That's, as he mentioned, close to 1,800 people that we can add to the workforce.
And that bill, you think, may be called up today?
Yeah, it's on the calendar for today, but we'll see.
Guys, thank you. We are better informed than we were before you got here. We thank you so very much, and good luck to you. We got